Sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
All around the country. I know we hit a lot of people during the course of the week, and I want to tell you tonight we have a real special guest. He's got an unbelievable portfolio of studies and where he studied and what hospital he studied at. Me being a Bostonian, he studied at some of the finest hospitals. So all you people that are from Boston and Boston area, you'll want to meet this gentleman if you have problems with your knees or your hips or whatever. We have a famous an orthopedic surgeon by the name of Dr. Alexander Gluckman. And right here, Doc, let me ask you a question. You've been around, you say you studied in Boston. Give us a little bit of history of where you started out and what made you get into orthopedic medicine.
All right, thanks, Lou, for having me here. So I'm originally from Florida, and I did most of my studies down here for undergraduate and graduate studies, and then I moved to Boston and went to Boston University Medical Center and did all my orthopedic training there, including my internship and my 4 years of orthopedics. As you know, it's a very busy hospital, and we go all around different facilities. And so we studied at most of our time is spent most of Boston University Medical Center, and then we do a lot of our training at MGH and at Lahey, as you mentioned earlier, and we do a little bit of pediatrics over and actually in Springfield, Massachusetts as well. So not a lot of people know about that. But
in Springfield?
Yeah, about the Shriners. So we do a lot of pediatric stuff there. And then I did my last year of training. So last year of orthopedics is usually typically considered a fellowship year. And you subspecialize depending on what your interests are. My interest was hip and knee. And so my patient population that I really specialize in is basically geriatric population. The majority of it, of course, I see patients all from 30 years old to 100 years old, mostly for hip and knee problems. So orthopedics, I think you were asking me earlier, is basically a study of bone and joints and the science that involves with it. So it's a very common specialty. It's very popular these days just because patient population is aging and baby boomers are, they're living longer and they're living healthier lives. And so basically our job as orthopedic surgeons, specifically for me, for hip and knee surgeons, are to improve the quality of life of patients and have them live as happy lives as possible.
I spoke to you outside. I have 2 torn meniscus. And I said, for the last 8 years, and I'm getting up there in age, and let me tell you, it's bad unless you get them fixed.
That's right.
And everybody says, well, if you even have a fear of getting them fixed, this gentleman, right, he studied at Mass General, too? You did some work at Mass General?
We do a little bit of work at Mass
Lahey
General.
Clinic?
That's right, yeah.
And a few of the other major hospitals.
Yeah.
So all those Bostonians up there think that Mass General is the epitome of hospitals.
They do. They do.
That's the place to go.
They have a good
if
reputation.
If they're down here, they want to run up to Mass General. Well, guess what, folks? You don't have to run to Mass General anymore. You come right here and see Dr. Gluckman. He trained at Mass General, so if he trained there, and I think you got a very special award, too, didn't you? You're one of the few guys that got accepted into a certain society?
Yeah, during residency, there's a certain fellowship that accepts, it's a American Orthopedic Association. It just accepts basically the top 2 residents of the nationwide. So that was something I was very fortunate to receive.
Did you hear that? Top 2 residents get accepted into society. Top 2 residents where? In the country or?
Yeah, that's right.
In the country?
Yeah, but it's an organization. It's focused on emerging leaders, basically, and that's what it was. It was orthopedic residents from all over the country.
Well, you're a Hall of Famer right now.
So, thank you.
You consider a Hall of Famer.
Yeah.
So tell us a little bit more. Let me ask you a question. One of in your bios, I said that you do robotic. And there's other doctors that don't do robotic. Because I've been checking around. Some do it, some don't do it.
Right. So
tell us the difference.
Yeah, so robotic surgery is very common. So it's all part of the umbrella of computer-assisted surgery. So computers have obviously permeated all of our lives, and it actually has permeated our lives in the OR as well, including the office and the clinic. So computer-assisted surgery is what robotics falls under, and basically what it is a computer that helps you position the components into a certain position to try to prevent any issues that may arise from malpositioning. So computer-assisted surgery. So one avenue is navigation, where it's basically just helping you position the components, and the robotics is actually usually a manual arm that positions the components for you. So the surgeon still does everything as far as the templating, the planning, and the operation of the robot, but the robot just assists you in doing some aspects of it. Robotic surgery is really interesting and has really made a lot of headway in the media, but it hasn't really changed outcomes. So if I took you and I took your twin brother, and I did manual instrumentation for you and I did robotics for your brother, you guys would be the exact same. Your brother's x-ray might look a little bit better, and that's what I mean by component positioning, but for as far as how you feel and what you tell me you feel, and your twin brother had the same exact surgery with robotic, they would feel the exact same way. And so
A friend of mine had his wife had knee surgery. Then he went back up to Boston. Of course, he went to the Mass General. And up there they said, well, they put the wrong knee in. It's too big for what you had. So does robotics stop that?
it does, especially some aspects of robotic surgery where they have a CT scan that can be taken of your actual native anatomy, and it helps the surgeon plan before the surgery's even been performed to plan the actual components that could be used. So it does, it brings patients from the outliers from the opposite ends and brings them closer together. So it makes everybody's x-ray look pretty much the same. It's really interesting, and it's exciting aspect of surgery for us, especially since a lot of people like robotics, and the newer generation of orthopedic surgeons that are coming out, they enjoy computers and they're really good with technology. So it's something that's very easy and native to us.
And what is that? They put 3 holes in your knee, 3 or 4 holes? Is that what they do?
Well, the approach to the knee, let's say if we're talking about the knee, the approach is pretty much the same exact way. There's certain little pins that they put in the femur and the tibia to help basically register the leg and to help the computer understand where everything is in relation to the preoperative imaging. And so there are other types of robotics as well that don't rely on CT or other imaging, that are just basically registration in the OR, where you don't have to have any special scans or any imaging. You just go into the OR and the robot helps you position the components in a certain position. So
Is there any preparation prior to that before you do robotic surgery that you have to do?
there's various certification programs that you have to fulfill in order to become robotic, basically certified for it. So yeah.
Now, one doctor, we were inquired, they said, I wanted my both knees done at one time. And a lot of docs won't do both knees at one time. Is that a reason why they won't do it?
There is, yeah. So there's a lot of good literature that patients do pretty much the same as far as functional outcomes from having one versus 2 done. However, it has to be tailored to the patient. There's some patients that are not good candidates for bilateral simultaneous total knee arthroplasty because they have a lot of comorbidities, especially cardiopulmonary comorbidities. And so it's a longer surgery, it's obviously longer blood loss or more blood loss. And there's a little bit of a difficult recovery. And so some patients are not great candidates for that.
Okay, so now the question is, I got a friend of mine who's a golfer, and he wants to basically have his knee done, but he says, gee, it's going to take me 4 months, 5 months, 6 months before I can play golf again. Is that how long it takes to heal?
Typically, my patients are up and walking the same day of the surgery or the next
Same day?
Yeah. So they're walking with the walker for the first 2 weeks. They're in a little bit of pain. I always tell my patients for the first 2 weeks, you're going to hate me and you're going to regret you did this. But at 6 weeks, you're typically thinking about how happy you are. So at 6 weeks, I'll let your patients usually go back to full activity, whether that be swimming, golfing, or running. So that's, of course, tailored to the patient. If they're doing great, they can even go back a little bit sooner. However, if patients are slower, they're not doing as good, they're not progressing with physical therapy, I might push them back a little bit. But on average, I'd say patients are going back to sports around 6 weeks to maybe.
6 weeks. That's not bad.
No.
So 6 weeks is fantastic. So if your golfers are out there, guess what? They've been feeling bad. Go see Dr. Gluckman. He'll have you out there in 6 weeks.
Yeah, I mean, the common thing is tennis as well. Patients are very active, especially down here in South Florida, and so they want to get back to tennis as quickly as possible. So, and that's
Is there any special exercise that you have to do, or you set up for therapy? Now, let's say the fellow gets his knee done in the hospital. Can he go home and get therapy at home, or does he basically have to go to a facility?
No, the majority of patients are actually who they receive physical therapy at the hospital, either on the same day or the next day, depending on what time the surgery was. But most patients have physical therapists come to their house for the first couple of weeks, especially during COVID times. patients don't want to go out to the facilities, and that's actually perfectly okay.
And that's what we do, folks. We do that home care. We who do that home care service. We provide physical therapy at home. So if you're listening to get your work done, ask for All County Health Care for the physical therapy. Well, another question is, people say 6 weeks, and that's not bad. Now, how long would it take to get the second knee done if they had the first one to complete in 6 weeks? Had to come back after the 6 weeks to get the second knee done?
So if they're having staggered total knees, if they're not having bilateral simultaneous total knees, it's usually about 3 months or so I have them wait. Again, depends on the patient.
Right.
Sometimes it's a little bit earlier, sometimes it's a little bit later. It all has to do with how quickly they're recovered. And the majority of that is based on their pre-operative status, if their functional status, if they're very high active and they're already they're doing a lot of rehab exercise by themselves, they have good muscle strength and they're always stretching, and they have good cardio health, they usually bounce back much quicker. And so they can be ready. Those are the patients that actually are good candidates for bilateral simultaneous total knees. And they're the ones that really do the best because their preoperative functional status is already so high.
So patients out there, if you've been suffering with bad knees, just think how difficult it is to live with bad knees, how difficult it is to get up and down, or bad hips. This man will have you up and going within 6 weeks, and if you have two of them, it takes you another couple of months, and you get basically less than 6 months, you'll have everything done.
Yeah, I'll tell you, the thing that people get upset about is they are really upset that they waited for so long to have, in order to not only have the surgery, but to see and have a consultation with an orthopedic surgeon. So the one advice I could give is seeing an orthopedic surgeon does not necessarily necessitate having surgery. It's having a consultation. And a lot of patients do well with non-operative therapy, so just having a consultation with a surgeon is also a good idea to do it earlier than later.
Does arthritis cause a lot of pain in the knees or hips? Is that a problem to arthritis with the knees and hips?
Yeah.
As far as, would you replace it if they had made a lot of arthritis?
It depends. It all depends on the patient. So some patients have a lot of arthritis. So osteoarthritis is the most common cause of arthritis in the hip and knees, and as well as in the upper extremities and the hands especially. So it's basically deterioration of the cartilage. Cartilage is that substance that allows your joints to glide smoothly. I always tell patients that cartilage is like tread on a tire. The more tread you have, the better your car runs.
Okay, so, we're going to take a break here, 30-second break for a little commercial. Can we get a commercial in there, my friend?
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do. Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks. We're here with Dr. Alexander Gochman, if I think I said it right. Correct, Doc?
That's right.
And I think his phone number is, if you need his phone number, he's got multiple locations right now. One in, I guess, in Boca Raton, one in Boynton Beach coming up.
Deerfield.
Deerfield Beach?
Yeah.
It's not in Boynton? So
There's one in Boynton as well.
There's
It's
one in
not
Boynton.
quite open just yet.
But his number right now, his phone number. Take this down, folks, because I think you really should see him. And all your Bostonians that are down here and you're worried about going back to Mass General or one of those hospitals up there, you don't have to anymore. He's right here. Dr. Alexander Gochman. His phone number is 561-955-6784. That's 561-955-6784. You know, we were talking about basically surgery, etc., but I'm sure you do other procedures other than surgery. If a person comes in and gets a consultation with you, not everyone gets surgery.
Yeah, it's absolutely right, Lou. Like I was saying previously, the majority of patients that come in for consultations are not necessarily ready for surgery. They may not be good surgical candidates. So there's a whole slew of other options that we institute. And so starting with physical therapy, with pain control, with activity modification, certain therapies we do, injections are all part of our armamentarium and are part of non-operative treatment. So I'd say the majority of patients that come in that get a consultation, we always start them on non-operative treatment. And if they progress and if they fail and if they need something else is when we start talking about surgery. And so.
And you've been practicing around here for 1 year, correct?
Yeah.
Correct so far?
That's right, Lou.
So listen, he's been down here for about a year, and he's the type of gentleman that just talking to him right now, he's very knowledgeable, and I'm sure he'll spend time with you. He's not one of these gentlemen I can tell right now by saying he's going to let you out in 5 minutes or 10 minutes. I think you will spend enough time with your patients and will should sort of satisfied with what you say.
Absolutely, Lou. Yeah, I mean, the majority of what we do is actually in the outpatient, in the clinic. And so building a relationship with a patient is very important to do in order to build trust among both sides. And it's always a shared decision-making when we talk about surgery, when we talk about any sort of treatment. And a lot of that involves the patient and the surgeon as well.
Now, you're with the Baptist Hospital Group, correct?
Yes, that's right.
So
yeah.
you're practicing where now? The hospitals?
So we practice at Boca Regional Hospital in Boca and then also in Bethesda East and West.
So don't forget, he's at Boca Regional. So if you folks are living in Wellington, you go see him, and you can even go to Boca, Bethesda West, which is like a hotel. I'll tell you, if that's the place you want to be, is that Bethesda West. You have your own private room. It's fantastic.
Yeah, it's a
He's at
beautiful
Bethesda
hospital.
East, and he's at Boca. So he covers, so you can go all the way from Wellington, Lake Worth, all those folks up there that have knee problems, and you're from that area, the New England area, you want to see Dr. Alexander here. And I'm going to turn it over to Delroy. Delroy's been anxious to ask him a question, but I sort of regret him. Go ahead, Delroy. You ask a question now. One question. That's all you're allowed.
So Doug, what can the people out there do to promote good bone health?
So good bone health is really important, especially when we start talking about a geriatric population. So good bone health really starts with activity, and doing weight-bearing exercise is really important. What I mean by that is less aerobic, although aerobics is really necessary and helpful, but more weight-bearing exercises. So they can find those type of classes in their gyms. They can find in their facility. A lot of places that people live here have community centers that offer weight-bearing exercises and training specifically. So But also a big factor of that is also your diet. And so the foods that you consume, as well as making sure you limit alcohol intake and stay away from, other substances that basically can deteriorate bone health.
So it was,
Delroy, you haven't been doing the right food. You haven't been doing the right exercise.
well, I haven't had any bone issues yet, so I guess I've been doing something right.
But if you compare Delroy right now with the doctor, you can see who eats properly and doesn't work out. So there's a Delroy or I, it's a doc.
You're doing good, Delroy. Don't worry.
So is most orthopedic issues from injuries or from people growing old?
So most, I would say, pathologies or some things that affect the bone or the joint are actually genetic. And so there's not things that people can pinpoint as having a specific time where they had an injury. So patients who come in, let's say with arthritis, which is, like I said, the most common type of joint problem, it's mostly genetic with them. And they'll have it in multiple joints, and they usually have a family history as well of their mom and dads who've also had problems, used a cane, a walker, always complained of pain. So, but there is also an aspect of patients that have inflammatory arthropathies where it's a genetic issue as well, but it's an autoimmune as well as injury and maybe an infectious process as well.
So if it's genetic, is there any preventative measures that one can take to mitigate?
Yeah,
that?
unfortunately, I mean, that's a great question. It's tough to fight genetics.
Right.
But staying healthy, having an active lifestyle, staying away from fatty foods and being active in every single day and staying away from tobacco smoke especially is extremely helpful to promote good bone health and joint health as well. But there's some things you just can't fight with, and that's where we come in basically to try to help. And
so you're predetermined based on your genetics.
Yeah, when you're born, you already have a certain
right.
amount of genetics that are
Okay.
being expressed that you can't really fight.
You
So
can't fight. Okay. All right.
At what point, Doc, should someone come in? What would the symptoms say of a bad hip or knee that they really say, oh, it's just local, I'll put some icy hot on it or something like that?
yeah,
At what point do you think they really should come in and get a consultation?
I would say at a point where you're no longer getting improvement from oral anti-inflammatories from Tylenol or ibuprofen or something similar to that. But I would really encourage patients to come in earlier because there's things that we can do and help make a diagnosis that really improves your quality of life. A lot of patients come in thinking they have back pain when it's actually an arthritic hip. And that's a very common problem that we see. They come in and say, Doc, my back is hurting, but they're really pointing to their groin or their thigh, and you get an x-ray, get a radiograph, and you can see they have a lot of arthritis on their joint. And so
I hear a lot of people say it's bone on bone. I hear my friends, oh, what's wrong with me? Oh, it's bone on bone.
yeah, bone
What's
on
it- what does
bone is a
bone
great
mean?
term. Yeah, it's a great term. We use it often as well. But again, essentially going back to that ball tire, at a certain point that ball tire just ruptures and you have nothing. You have no more rubber, and that's basically what a bone on bone is, where you're just grinding your wheel against the concrete. And there's no more cartilage left whatsoever.
So it's like a brake pad, scraping.
That's also, I like that analogy actually even better, but that's right.
It's like a brake pad.
You have no more brake pads at that
Right.
point. And so,
Listen, guys, if you're running out of brake pads on your knees, make sure you go see Doc right over here. His
right,
phone number is, again, 9561-955-6784. Tell us a little bit of difference between, what is arthritis? People say I got arthritis.
arthritis is basically an inflammation of the joint. And so that, and again, it's a big umbrella term, and there's different types of arthritis. Like I was saying, osteoarthritis is a very common one, inflammatory arthropathy. These traumatic arthritis are all types of arthritis. It's basically any pathology that involves the joint. And so, and any joint. So you can use that to describe any joint: the neck, the back, the hips, the legs, the feet. And so,
Well, we got to sum this up because I'm getting a signal that we got 1 minute left. I guess we're down to 30 seconds. Doctor, I can tell you very graciously they have you here, and you're fantastic
Thanks
with
for
your
having me,
background. I reviewed that background. I said, what a fantastic young man. And again, his number is 561-955-6784. So if you think you're suffering from arthritis or knee or hip problems, go and see him. Dr. Alexander Gochman.
thanks, Lou.
Thanks,
Lou.
Jen. You're welcome back
you, Doc.
anytime, Doc.
Appreciate it.
Thank you.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, Call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.